In the heart of Africa, where the vibrant rhythms of life intertwine with a challenging healthcare landscape, a digital revolution is quietly unfolding. For decades, the continent has faced daunting healthcare hurdles, limited access to medical services, a shortage of skilled healthcare professionals, and the burden of infectious diseases. But today, the winds of change are sweeping across this vast continent.
Particularly, I'd like to talk a little bit about the evolution of our organization. We were founded, at the time we were called PayCalc Foundation, in 2007. And at that time, really, the idea of using mobile technology or digital health digital systems to improve health was really quite a novel one. There was very little evidence that would say that actually this could be done. And so we were really testing things out, working out if they worked, working out if they could be scaled, and starting from scratch pretty much. Over the next few years, a lot of research happened around what is the impact of digital media and health. And that primarily came from the academic sector. So we had a lot of academics looking into, if we create this kind of system, if we engage in this kind of way, what is the impact that we can have? Can we improve health outcomes? Can we improve the quality of care? Now, that was amazing because you don't want to scale something that doesn't have impact. But the problem that it created was this problem of pilotitis, where there were many solutions at a very small scale. And it was very hard to scale any of these solutions. Scaling of academic or small scale programs that were built was actually far harder than anyone expected. I think what set us apart at Reach Digital Health is we really focused on scale right from the beginning. We leveraged off the data that other people were developing around where the potential impact could be, and also tested, can we scale this? Because for us, digital health is about scale. You don't really need a digital health solution if you're trying to reach 100 people. Where you need a digital health solution is if you're trying to reach a whole population of people. And so that's why we took both of those approaches. I would say in the earlier days of digital health, and certainly before COVID-19, there was a huge emphasis on how to gather data and to digitize paper-based records. This is obviously incredibly useful, but there was very little explored in other areas, or very little data developed around the impact of, for example, speaking directly to citizens, which is where we focused as an organization. And so for many years, there was a lot of skepticism about whether or not that was a useful part of digital health, or whether we really still needed to focus on digitalization of paper-based solutions. Now, when COVID-19 hit, we saw a rapid acceleration in this space, and there were a number of reasons for that. Firstly, the digitized systems that have been put in place to replace paper became far more valuable because they could give data much faster. And so the real-time need for real-time data was incredibly important at the time. The second thing that happened was, particularly in the space of speaking directly to citizens, nobody had the information that they needed. And traditional ways of disseminating information through a health system just didn't work anymore. Digital was absolutely critical to getting the right information to the right people as quickly as possible. And these people range from healthcare workers to health officials to citizens of the country. And so we saw a huge change in the acceptance of that kind of digital health during COVID-19. And we see that evolving post the pandemic, and a much bigger acceptance of the need to be able to speak directly to citizens.
Yeah. So, if I take the Ethiopian case, it has been more than 2 decades since Ethiopia started implementing various digital innovators. And the first one has been the national HMIS application, which we have been using for the last 20 years to collect health and health-related data, starting from health centers up to the national level. So at the beginning, we were using this application to gather health service data, disease and service-related data. Now, with that beginning, at this stage, we have now developed more than a dozen of digital health applications. The ministry has now cognizant of the importance of digital health, how it is transformative, and how it can support the ministry's agenda to achieve its, be it SDG or national health transformation plans. So with that recognition, the ministry has now set out various digital health policies and guidelines, and in accordance with that, we have been implementing various digital health solutions. As I said, starting from the HMI solutions we have used for that health data collections. So for instance, currently we are using electronic medical record systems to digitalize the medical records at health facility levels. This is one of the priority initiatives in the country. And also we have been implementing the community-based health information systems, ECHIS. This is a very crucial digital health information system to address the community levels health and health related data, especially in providing health educations. As you know, Ethiopia is famous for the health extension program. So with that, the community-based health information system provides a great platform for the health extension workers. So one of the digital health initiatives we have is the community-based health information system, what we call it ECHIS. And also we are implementing the health work information system, that is IHRS. This is also one of the priority health information systems we are implementing to have up-to-date real-time data about health workforce data, about the type of health workforce we have, their qualification, their geographical distribution. And also we are implementing the let me say supply chain information systems, which are very important to trace the drug and drug related informations we have in the country. So with this all, what we can say is that with the advancement of information communication technology and the recognition of by the various government officials, the higher level management as the ministry, the recognition that digital health has a very high impact to transform the health sector, we are now implementing aggressively various digital health solutions. So this indicated how the digital health is evolving, starting from health data collection up to service provision, up to health education, up to digital health literacy. So I can say that it has been aggressively evolving digital health in Ethiopia. So we can, starting from Ethiopia, we can say in Africa also similarly various countries are now having their own digital health agenda, so that they can realize the benefits of digital health.
So digital health across Africa spans over 2 decades. In the early 2000s, you had the use of mobile phones and basic patient information, health education tips. To mid 2000s, where with launch of mobile money like M-Pesa or Kenya, laying the foundation for healthcare transactions across various fintech platforms. And in the late 2000s, we then see a lot of African countries exploring through PPPs, public-private partnership, for, as an example, through partnership with telecom companies, enabling internet access and connectivity to deliver healthcare solutions and the proliferation of telehealth solutions, even though they were operating in silos due to various barriers. And then thanks to COVID pandemic, we now see the adoption, which has now like the adoption of telemedicine across the continent. MobiHealth is one of those innovative solutions, like delivering an end-to-end solution that connects the patient to all healthcare services along the value chain. And we're very excited to be part of this solution.
Now, the biggest challenge is kind of an obvious one. It's one that we've spoken about a lot, but it's really is that Data-driven means data needs to be available. And most of the data that data-driven models are being trained on is centered in the global north. It is centered around white males. And so what that means is that anyone who does not fall into that category potentially has either not enough data to train a model on, or very biased data that doesn't take into account their specific needs. And in South Africa, in Africa, we have really a massive challenge with that for all parts of the population. The second thing is that many of the data-driven platforms that are being developed at the moment, for example, large language models, need large amounts of data to train them from a language perspective. Whereas most of the languages that we have seen, that we work with in Africa, have very low resources in terms of data. So it's very hard to do something like train a large language model in a language that doesn't have enough data. And so the generation of data, the generation of unbiased data, the generation of data that takes into account the various parts that make us who we are and the personalization that's needed is a massive challenge for us, particularly in Africa, in using data-driven models for health. Now, that doesn't mean that it's not still exciting, that there are so many of these evolutions happening at the moment. And I think that what is particularly important to understand is that we need to accelerate improvements in health in order to get to universal healthcare in 2030. And in Africa and in many of the global South nations, that is particularly important. And so without technology, it is highly unlikely that we will reach universal healthcare by 2030. The standard systems that have been put in place, the attempts to reach universal healthcare, have unfortunately fallen very short of our targets. COVID-19 further eroded some of the progress that we had made. And so now we're looking at a situation where we need massive acceleration in order to reach universal healthcare by 2030. And so technology is an obvious way that we're going to be able to improve that. And so seeing all of these innovations and advances in data-driven models means that hopefully we'll be able to leverage those in order to accelerate data-driven health in Africa. Of course, there still remain challenges, but the two main areas that we are looking at for our work, where we're using data-driven models, is really focused on the fact that we are speaking directly to citizens at a really large scale, and that these citizens are very unique and need personalized messaging to change their behavior. So the first problem we have is that the more different types of people we're speaking to, the more we want to personalize and segment the groups of people we're speaking to so that we can have a bigger impact with the messaging that we're sending them to, the more complex our systems are becoming. And so we're really reaching the edge of what we can do with traditional systems, and we're starting to move into data-driven and AI systems, because that really is going to allow us to be far more personalized in reaching the myriad different people with the myriad different needs on the African continent. The second thing is, if we want to reach out to very different people, we need lots of very different content in order to do that. Now, content creation is extremely expensive. It's also complex because we need to make sure that it is of high quality from a medical perspective, from a behavior change perspective, and that it has the right tone for communicating directly to different target markets. Now, large language models do give us the opportunity to be able to take base content and adapt it much faster than we've been able to in the past. And so we're experimenting in both of these areas. Models for recommending or personalizing the communication that goes out to people, and large language models for adapting and personalizing content. And we believe that those two together are going to have a massive impact on our work in the next few years and allow us to be able to help many more citizens, but also to be able to help them in a much more specific and personalized way.
So as you know, data-driven digital health has a great promise for improving healthcare outcomes and patient experience, but also it also brings its own risks. And that should be carefully managed. Some of the challenges I can mention are the following. For instance, one of the concern area is privacy and security concerns. We have to make sure that health data is not accessed by unauthorized people. That is one of the major challenges we are facing. When we collect data digitally, it might be accessed by unauthorized personnel. So that's one thing. The other is data breaches. Health data can be, if you are not properly managing health data we collect digitally, it can be accessed through various means. So hackers can access our health data, they can breach our security system, and they can expose private health data. That should be one of the concerns we have to taking care of. The other one is data quality. Health data has to be in good quality, and it has to be collected in representative of the real fact on the ground. So whether knowingly or unknowingly, health data can be collected with not good quality. So that's also another challenge. The other is bias. When you collect health data, it could be biased in terms of racial discrimination, gender discrimination, or socio-economic biases. So we have to make sure that these issues are addressed when we collect health data digitally. The other challenge we are facing with regard to digital health is that legal challenges in terms of compliance with regulations and rules in the country. Various countries, different countries could have their own regulatory frameworks in terms of health data collections and the standards they are following. So we have to make sure that health data is collected in accordance with the legal and regulatory compliances. For instance, in Ethiopia, we have adopted this International Code of Disease Classification, that's ICD-11. So we have to make sure that whether they are private entities or government institutions, they have to follow that disease code when they collect health data, whether it's from private facilities or government facilities. This should be adopted. And the other challenge we are facing with regard to digital health data is data overload. So as you know, we are generating an enormous amount of health data these days. So we have to make sure that we have to properly manage that health data. It should not overwhelm us when we collect health data. Health data came in digital form in various formats. It can come in text format, in video format, imageries. So we could have an enormous amount of health data at our hands. So we shouldn't be overloaded with that. We have to properly manage that one and utilize for our benefits. That's also another challenge where we're facing with respect to digital health data. The other one is the digital health divide, as you know. This is also another challenge we are facing. We call it health inequality. With the advancement of digital technology, the digital literacy is now a big challenge. We have to make sure that all the population or our health workers are digitally literate, and we shouldn't create another divide in terms of the ones which are literate in terms of digital health and the ones which are not literate. So with the advancements of digital health, the challenges, one of the challenges we are facing is that digital literacy. So that's one challenge we have to make sure. And the other is that, as you know, as a developing country, like as in Ethiopia, when we are totally dependent on technology, sometimes in case of unexpected situations, we might not be in a good situation where the technology is not properly working. For instance, online applications, I can mention an example. We have the HMI store, which is centrally stored at the ministry data center. So whenever there is an outage in power or in internet connectivity, we are not accessing our health data. So with the advancement of health technology, sometimes we may be totally dependent on technology, and when that technology is not accessible due to various reasons, we might be in a disadvantaged situation. So these are some of the challenges. As I said at the beginning, digital technology has an enormous potential and enormous advantage. We have to utilize that one, but we have to make sure that we are properly addressing the challenges we might be facing when we are entering in that ecosystem.
It offers a lot of opportunity for our healthcare barriers, but of course not without the challenges that we have to overcome. Infrastructure challenges, the fact that we have poor digital infrastructure and high cost of internet data. What we find to adopt the adopter of these solutions, especially for the last mile. To also basic infrastructure like power supply. If a patient does not have access to internet, does not have access to power, electricity, they cannot charge their phone, they cannot charge their computers. So those are some of the limiting factors. And then we have the lack of aggressive digital health policy that is that is needed to create an enabling environment for innovators to thrive, and investors want to have peace of mind that their investment. So we have a lot of challenges, and without the perfect sum of investment, innovation, and cohesive digital policy, it will become very difficult to leverage this in the industrial revolution healthcare. Data-driven healthcare innovations can really help Africa leapfrog our healthcare barriers and deliver sustainable, cost-effective healthcare models for the continent. From improvement in healthcare access, like delivered in telemedicine, that can help to bridge shortage of doctors, distance and language barrier, to the development of wearable tools where curated data can help deliver more quality-specific healthcare solutions like treatment plan to patient-personalized medicine, to healthcare education that can help communities lead healthier lives and lead more quality and have more quality healthcare outcomes. And then to prevention of disease outbreaks, monitoring and prevention of disease outbreaks, as we saw with Ebola and the COVID pandemic. The Internet of Things, AI, offers promise for the continent, but we need to address the various challenges from privacy and data security issues to the ethical considerations that we need to give to patients' data, as well as just ensuring that we have the right digital health infrastructure and other infrastructure power and so on to deliver these services.
So I can mention some of the opportunities we have benefited from digital health. The first one is personalized medicine. As you know, previously we have medical practices where we provide for the general community. But now these days, with the advancement of technology, with data-driven digital health, we can specifically design our treatment, our patient engagements with that specific need of individual patients. So that's one of the advantages we are having in terms of digitalized healthcare. The other is early disease detection. As you know, with health data, we can proactively follow up pandemic outbreaks and the like. So with the technology, we call it predictive analysis and business intelligence, we can proactively make decisions about disease detections. So that's one of the opportunities we are having in terms of with digital. The other one is remote monitoring of patients. With the technology, we can now remotely monitor our patients, and we can provide treatments to our patients. So the technology has now enabling us to sit somewhere else, be it within a geographically remote area or with a time variant. We can be in various time zones, but we can provide such treatments. The other is telemedicine. In countries like Ethiopia, where we have health accessibility is very, very small, we can use telemedicine services to access our patients in remote parts of the country. So this is another opportunity we have having with digital health. The other is, as I mentioned previously, is health data analytics. So with digital health, we have the opportunity to do data mining, knowledge discovery, data associations. So these are all the opportunities we are coming to us with advancements of digital technology. So we can do various digital health data analytics, modeling, and the like. So that's also another advantage we have. We have digital health. The other one is we have the patient engagement. With the advancement of technology now, we are making our patients are now more educated. They can access the health data online. So when they come to the health facility, they have some knowledge and they can be engaged with the physician more proactively. And as we know, we always say that the health system, the previous health system is not democratic, where the patient is the recipient of all the recommendation from the physician side. But now with digital technology, health data is accessible. The health information in general can be accessible for our patients, so they can be more proactively engaged with their physicians. The other is supply chain management. This is one of the challenges we are facing, especially in Ethiopia, for instance. We bring drugs and the others, the likes, but we cannot properly follow up the timely delivery of the supplies, their wastage and the like. So this is another advantage we have with digital technology. The other one is the health education we have with digital health. So we can educate our patients, our health workers digitally. So this is one of the advantage we are having. We have now the CPD program in Ethiopia, which is the continuous professional development. We advance our health workers with technology. So we provide them the latest protocols or the likes with our technology-driven digital e-learning platforms. So that's an advantage. The other is research and development. With digital technology, we can advance our researches and the like. So digital health has brought a lot of opportunities for the health sector. I just mentioned some of the advantages we have brought with digital tools at our disposals. In the future, we can have so many digital technologies, and we can take advantage of that technology to our benefits. Thank you.
As we celebrate this year's Digital Health Week, you must see that the dream of a digitally empowered healthcare in Africa can only be achieved collectively by carefully considering not only the potential benefit, but also the potential associated risk that need to be mitigated. Join us in ensuring that we achieve growth of digital health in Africa in the coming years.